you know, the most egregious violations of human rights occur in the mental health system and the healthcare system as a whole. We see it all the time. That's why we have so much depression and violence in our society as well. And we call it the hospital to prison pipeline at this point. 53% of all men in state prisons have a diagnosed mental illness, and 73% of all women in state prisons have a diagnosed mental illness. That's unbelievable. So now let's move on to the farm. We have Leslea Hodgson, who runs a farm with her husband in Fillmore County in southern Minnesota. You know, Gene Ross told me it's not Minnesota. You have to say Minnesota. So here's Leslea. Let's give it up for Leslea.
Thank you. I'm Leslea Hodgson. I'm a member of the Land Stewardship Project's Healthcare Organizing Committee for rural Minnesotans. I have issues with the status quo healthcare system. Together with my husband, I graze cattle, sell the beef, and run a cabinet shop on our southeast Minnesota farm. Before we began farming and working independently, we had jobs that provided partial cost share on a group policy. After 15 years of the struggle of trying to farm and work off the farm to get health care coverage, we decided to dedicate our energies to our own enterprises, raising livestock and building the cabinets in the shop that we had built. Because the cattle herd had grown and the cabinet shop had picked up more orders, we realized that to properly care for our livestock, and now after I realize how many nurses are in the room, you'll know when the vet leaves, after the vet wraps that wound up and sticks them with the shot and they leave, then that 1,200 pounder is yours to get home. So I'm the nurse of the cows, and working for ourselves meant buying health care in the individual market, though, which we did for about 3 years until the deductible, the letter came in the mail and the deductible was raised without our consent. I didn't know they could do that. And the premiums rose yet another 25% that year, which they had been doing year after year. We've tried since then to take an off-farm job to get health insurance, but it would only cover one of us at a time, or if we did want the other one covered, by that time then the premium became so high that these jobs, there's not enough left in the paycheck, like to maybe cover the fuel that it takes to drive 40 miles to get to the job in rural Minnesota. So we did what we could. Let's see, we purchased a policy off the individual market for which we both had high premiums and a high deductible, so we could never actually go to the doctor. And if we did, we would end up going into debt to do that. Felt like we were being ripped off and our premiums were not being used for us. Like our policy is the type of insurance policy that many insurance companies would like more of, like money for nothing. So we decided to go with the nothing option and discontinue insurance. But a farm accident or a serious health problem would have ruined us during this time. And finally, in 2014, we found out about Minnesota Care and qualified for a good comprehensive insurance with no deductible and a low premium cost. So we couldn't find that type of policy on the open market, and the high deductible premium out-of-pocket policies that they call affordable are not health care at all. They're just catastrophic care. That kind of policy will leave us open to huge medical debt, bankruptcy, and losing all that we have worked hard to build. We need solutions for everyone, no matter who you are or where you are. I hope we can make a change. It's unfair what's happening. And organizing like we do with Land Stewardship Project is what won Minnesota Care, because they're trying to get rid of that every chance they get. And it's really important for a lot of people. And so hope we can win health care for all. Thank you for listening to my story.
Thank you, Leslie. That was incredible.